Hello, I'm Dr. Ruben Rucoba, a pediatrician from PediaTrust, and your moderator for tonight's live Q&A session regarding the COVID-19 vaccination for those children under the age of 5 years old. Joining me on the panel tonight will be Dr. Jonathan Kaufman, pediatrician at Pediatric Associates of Barrington, with offices in Barrington and Crystal Lake. Dr. Laurie Hochberg, pediatrician at Pediatric Partners, with offices in Vernon Hills and Highland Park, and Dr. Mufadal Moosabhoy, pediatrician at Hinsdale Pediatrics, obviously located in Hinsdale. We've got a lot of questions that have come in over the last couple of weeks from registrants, and we'll get to as many of those as we can tonight. You also have the ability to send in live questions either through the chat function for those of you on Zoom or through Facebook Live. And don't worry if you missed something during the session tonight. We are recording this, and over the next few days, we'll be sending out an email with a link on how to access the recording, and it will also be on the PediaTrust website. We want to respect everyone's time, so we'll try and wrap this up promptly around 7 o'clock. So let's get to it. This first question is for Dr. Kaufman, and it's one we've gotten asked in a number of different ways. Knowing that kids are generally not getting very sick with the current strains, what does getting vaccinated help with? What is your response to that, parent, Dr. Kaufman?
Thank you, Dr. Rucoba, and thank you for everybody for joining in. I hope it can give you some more information that can be helpful in making your decisions. That is true. Kids generally are not getting very sick. I can think of about 3 or 4 real brief reasons why we still would recommend that the vaccination be given. Although children are not getting sick, there's a tremendous number of children that are getting COVID, and it's a big burden of illness. Yes, children are not getting as severely ill as adults generally did with the COVID, but my latest research says, or data says, that since the beginning of the pandemic, over 400 children between ages 0 and 4 have actually died from COVID. And that's the highest compared to some of the other vaccine preventable illnesses such as varicella or influenza. So I think a lot of us would agree that one death is one too many deaths. And I think that one of the major focuses of the vaccination is prevention and decrease in severity of disease, and then preventing hospitalization and death. So to me, that would be a major reason. The other one, as I mentioned, is the burden of disease and illness, the sheer numbers of children getting sick, and then the potential disruption of their lifestyle. Albeit we saw that over the last couple of years with schools getting shut down, programs getting shut down, people having to stay home, parents having to stay home because of exposures, and the total disruption in lifestyle and all the implications with that. And then the last one would be complications. Long haul COVID would be the big one. But there are certainly others that likely will come up as we go forward with the COVID and its history. But for those reasons, I would think, even though children are not getting very sick, the vaccine would be extremely helpful and beneficial.
Thanks. Dr. Hochberg, this next question is for you, and it relates a little bit to the first question. One parent wrote in, all of my children 5 years and older have been vaccinated and still got COVID. So why vaccinate? Now, what do you say to that parent?
Well, I may repeat a couple of things that Dr. Kaufman said, but just to reiterate, children who've been vaccinated with the COVID-19 vaccine are much less sick than those who are unvaccinated. Many children have developed, with COVID, have developed high fever, bad cough, runny nose, body aches, fatigue. Some have pretty bad vomiting and diarrhea. If vaccinated, much of these symptoms are lessened and shorter lived. And there's really no way to know in advance how a child will do with COVID. Some can develop this multi-system inflammatory syndrome a couple weeks later, which involves inflammatory reactions of all the different organs, hearts, kidneys, lungs, stomach, brain. It can even result in a decreased function overall of the heart. With the vaccine, the chance of developing this MIS-C, as it's called, is decreased. Same with the long COVID that Dr. Kaufman mentioned. Some people have had excessive fatigue, decrease in endurance, joint pains, heart racing, headaches, dizziness, brain fog. This can last for months. And again, the COVID vaccine appears to reduce the long COVID symptoms by about 50%. In addition, children with underlying medical conditions can get even sicker. So any child that's obese, has diabetes, asthma, congenital heart disease, other neurologic disorders can get much sicker if they're not vaccinated. The vaccination also seems to decrease the chance that a young child could spread COVID to elderly relatives. Early on in COVID, children weren't really getting the virus as much as older people were. Now, with the more recent strains, they're catching it and spreading it to others. Studies have shown that people who are vaccinated and still get COVID, or those who have had COVID and also get the vaccine, are developing higher antibody levels than people who just have COVID who haven't been vaccinated. It's believed that natural COVID infection provides about 90 days of immunity for most people who are not immunocompromised. Getting vaccinated can extend this immunity and reduce the severity of symptoms if you get sick because the antibody protection is greater.
Thank you for that. I'd like to reiterate that, the main goal of the vaccine is not necessarily to prevent cases of COVID. That's a nice goal, but the main goal is to prevent serious hospitalization cases of COVID and death. And there have been a number of deaths, over 200 in the youngest age group of 6 months to 4 years old since the pandemic began. So yes, generally it's a mild illness, but if you're a parent of one of those 200 kids, it's certainly something much, much worse. All right. One parent asked, is there data showing how much getting vaccinated stops the spread to others? Dr. Hochberg touched on that. And Dr. Moosabhoy, how do you respond to that question?
Yeah, thanks, Dr. Rucoba. So the short answer to that is yes. There was actually a study back in early 2021 that in England that looked at spread through households, comparing those who were vaccinated and those who weren't. And they found that 40 to 50% lower or reduced household transmission. So the short answer is yes. And there's a lot of variables you look at with that. We definitely weren't in the midst of Omicron, which is 4 to 5 times more transmissible than the Delta strain we were dealing with at that time. But on the same note, you look at the vaccines that were studied just recently in the kids under 5. The efficacy of the Pfizer vaccine was 80% in preventing symptomatic infection, and Moderna was 51% for the younger kids, 6 months to 2 years, and 37% for 2 years to 5 years. So we know that the vaccines are reducing the symptoms of infection. And if you're less symptomatic, there's a less chance of you spreading that illness between family members, friends, and other people. And remember, if you don't get infected in the first place, thanks to the vaccine, then you can't spread it. So I think that's the most important takeaway is the less people that get infected, the less they can infect other people. And that compounds one on top of the other. So everybody needs to get vaccinated in order to stop that spread.
Thank you, Dr. Moosabhoy. Here's a good question for Dr. Kaufman. Is there any difference in safety for those under 1-year-old versus the older toddlers?
So again, the short answer is no. I think the important thing to remember with development of any of these vaccines for children is that safety is always the first thing that's tested. And if they're not safe, then they don't go on to efficacy studies. So these vaccines have been shown to be very safe. There are some mild differences, which I think within side effects in the different vaccines and the different age groups, 6 to 23 months versus 2 to 5-year-olds, which I'll probably touch on in a little bit. But the vaccines have been shown both to be very safe in both vaccines. None of these clinical trials they tested, none of those children developed the myocarditis side effect from the vaccines. And I think that's very important to remember for everybody to realize. So yes, absolutely, the vaccines are safe as far as we know at this point.
Thank you. One parent wants to know, speaking of side effects, what are the side effects after the shot, and do children do better than adults? Dr. Hochberg, what do you say?
So the most common side effects are similar to what we see with most vaccines. Pain, redness, swelling at the injection site, some fever. With this vaccine, there is some underarm or groin lymph node swelling sometimes and tenderness on the same side as the injection. The side effects were mostly considered very mild and did not interfere with any activity levels. They lasted about 1 to 2 days and no longer than 3 days after the injection. Differences in age groups showed that 6 to 36-month-olds were a little more fussy, a little sleepier, and had a little decrease in appetite. Whereas in the older, the 3 to 5-year-olds, there was the most common symptoms were fatigue, headache, muscle aches, some chills, sometimes rarely nausea and vomiting, and some joint stiffness. The side effects, such as the fever and joint pain, were more common after the second dose. To decrease the side effects, it does help to sometimes apply a cool cloth to the injection site if it feels kind of warm and irritated. Move the muscle around a lot. We tell everybody to kind of move your arm around a lot after you get your shot. Drink plenty of liquids. Dress lightly, especially in the summertime now if we're feeling really warm. We don't recommend pre-medicating with Tylenol or Benadryl. It's okay to give after if needed, but really not necessary unless a child is really uncomfortable. There's also a very rare risk of an allergic reaction to the vaccine, and this is not more common in this vaccine. It happens with any vaccine that we give. So because of that, we watch every child for 15 minutes. And if a child has had a previous reaction to a vaccine or an injection, we usually watch them for about 30 minutes. The good news is that even if someone does get an allergic reaction, we are all equipped to treat it, and it will be a completely safe situation. Like I said, this is very rare, and different studies have shown about 11 cases of anaphylaxis out of 1 million doses given. So very rare.
Thanks, Dr. Hochberg. And one other thing I'd like to add, the studies did show that with the Moderna vaccine, there was a slight increase in fever across all the age groups compared to the Pfizer dose. But again, none of those fevers were, dangerous in any way, and usually went away after about a day. All right, Dr. Moosabhoy, one parent wants to know, what are the cons of kids under 5 getting the vaccine?
That's a great question. I mean, I think it's important for us to get ahead of what parents are, what's making parents resistant, or, why parents are hesitant about these vaccines, in order for us to be able to help parents feel more comfortable and understand better the information that we have from reading and from seeing other patients as we're administering these vaccines in the office. So there were 3, I kind of came up with 3 major quote unquote cons that parents have brought to my attention. And you guys may have seen some other ones that you can bring up, maybe help me with as well. But the first one was the side effects. And Dr. Hochberg kind of went through all of those in good detail. But that's always been something that has been brought to my attention, that parents are worried about those side effects to the vaccines. And as you mentioned, they're all short-term side effects. They're all manageable with hydration, rest, and ibuprofen or Tylenol. And I think that's, of course, we don't want to see our kids with fevers or body aches or feeling uncomfortable, but I think that's a very short-term issue that again is very easily manageable and taken care of. The second thing is this concern that the vaccine might not protect against variants. So, it was developed more than a year ago. We hadn't even heard of Omicron at that time, and now most all of what we're seeing is Omicron. And it's true that the vaccine may be slightly less effective against the Omicron variant itself, but it still has been strongly proven to protect us from hospitalization and death. And we've seen that in the numbers. More than 97% of admitted children are still unvaccinated. And remember that the baby vaccine, the one that just came out, was studied during Omicron and still showed good effectiveness, right? 80% for Pfizer, 40 to 50% for Moderna. So that the numbers and the data are still good, and those were studied with Omicron. The last thing that I hear mostly is about the long-term impact of the vaccine. What's it going to do to my child in the long run? Are they going to have some issues 10 years from now because of the vaccine? And is that something that I would have done? And that's a great question. And you know, there's two things I would say to that. Number one is the vaccine's been around for more than 18 months now. So we've got a year and a half of data on the people who got it first round. Most of those were us, the healthcare workers. And, you know, we're still doing well. You know, the side effects to vaccines have been limited. We haven't seen any long-term issues from these vaccines through the 18 months. I think we have to remember that the mRNA vaccine has been around for a long time. It's been studied for more than 25 years. And we haven't known of any long-term complications from that. The last thing I would mention is that, you know, I understand the concern long-term with the vaccine, but what I always tell my patients is, I don't know what COVID's doing to our bodies, right? You know, COVID causes this MIS-C that was discussed, inflammation in the body, effect on the heart and the lungs, effect on our mental health. And you really have to look at what those potential long-term effects of a significant COVID infection might be on you or your child. And I think the best thing you can do is vaccinate, keep the symptoms mild if you do get COVID by vaccinating, and therefore less inflammation and less long-term effects.
Thanks, Dr. Moosabhoy. All right, so this is $1 million question that's going to go to Dr. Kaufman. Somebody wrote in on the chat tonight, basically the question that a lot of parents are asking themselves is, you've got two different vaccines. The clinical data is out there. Efficacy seems to be a little bit different for them. Pfizer a little bit better, Moderna not so much. Moderna has 2 doses, Pfizer's 3. So which do we choose for our 4-year-old child? So Dr. Kaufman, what do you say?
Well, the really good news is that you can win a lottery with either one of them. You can win those $1 million. There is no wrong choice to make here if you choose to vaccinate, which would be the right choice. It really just depends on availability, your personal preference. I think the differences in the vaccine number shots, 3 for Pfizer versus 2 for Moderna. And remember that the most immunity is conferred after that 3rd dose of Pfizer. So you really can't do the first 2 and skip the 3rd. Currently also, they're not interchangeable. Again, all that may change down the road, so you have to sort of stick with the plan. I think as far as, again, availability, the number of shots, what you would feel comfortable with. If your intent is to vaccinate fully and completely before school starts or preschool starts, then you may want to go with the 2 dose. It's done more quickly if you're worried about the timing on it. I think one of the logistical difficulties for a lot of practices is that the Pfizer vaccine was rolled out and distributed more quickly, even though they were both approved around the same time than the Moderna vaccine. I know in PediaTrust, there have been some delays in shipping and ordering and things like that. So most of us are currently doing mostly just Pfizer vaccine. You also have to remember that they are completely different vaccines in terms of the way they're administered and the dosing. So all of us, including our staff, go through rigorous training on each individual company's vaccine program. So it's not just ship and deliver. There's a lot of behind the scenes work that we all are doing to implement this vaccine program safely. So you cannot lose by choosing either one, whichever one you think is more available and would fit your lifestyle and your plan. Go for it, go get it.
I'd like to add 2 points to that. One was I was on a clinician call with the CDC, and there was a couple of people from the CDC and the FDA. They have absolutely no financial interest in one over the other. And everybody said the same thing. Don't overthink this. Get one or the other. They're both fine. They're both going to protect your child. I will say the Moderna vaccine, although it's only 2 doses, it's a bit of an illusion, because I think a 3rd dose is going to be required fairly soon, like in the fall. They're going to come back and say, well, you need a 3rd booster dose. So they're kind of even. But either one is going to protect your child. So I wouldn't fret too much about which one to get. I would just get them vaccinated. And then I'm going to address another question that came in through the live chat. Why is it so difficult to find a location offering Moderna for under 5? Dr. Kaufman mentioned some of the reasons they didn't roll it out as well or as quickly as the Pfizer, even though both got approved at the same time. But I can tell you, if you're a PediaTrust patient, 2 of our sites are offering the Moderna along with the Pfizer. That's Woodfield Pediatrics in Schaumburg and Elm Street Pediatrics in Winnetka. So you may have to drive, but those are 2 PediaTrust sites where you can get the Moderna vaccine. All right. Dr. Hochberg, here's an easy question. How many doses are they expecting for this age group?
So at this point, as we've said, the Moderna vaccine is currently a series of 2 doses, starting with children 6 months through 5 years of age. And they are spaced about 4 weeks apart, about at least 28 days apart. The dosage is a quarter of the adult dose, or 25 micrograms. And like we said, Moderna is currently studying a 3rd dose. And we anticipate that once those studies are completed, they will add that 3rd dose to increase the efficacy of the vaccine. Pfizer, the current vaccine that's out for children 6 months through 4 years of age, is a 3-shot series, 2 doses spaced 3 weeks apart, followed by a 3rd dose at least 2 months later. The dosage for this is 1/10 of the adult dose, or 3 micrograms per dose. Moderna is most effective, they say, starting 14 days after the 2nd dose. And Pfizer is most effective 7 days after the 3rd dose.
Thank you. Dr. Moosabhoy, this question came in live tonight as well. Are we seeing the long COVID as much with Omicron as we did with the earlier, more severe strains? We don't seem to hear much about the long COVID as much anymore.
Yeah, that's definitely true. And I think the way I would answer that is, it may be a vague answer, but there's so much about COVID that we still don't understand. And we're still learning as we go and seeing these new strains of COVID and how they affect our bodies. It's all a learning process for everybody. And so why we're seeing less MIS-C with Omicron, maybe because the symptoms are milder in general compared to the previous strains like the Delta strain. I don't know that there's a great answer, but I think that the short answer to your question is yes, we are seeing less MIS-C than we did early on. And even before it was a rare occurrence, but it was happening. It's devastating in the patients that ended up being diagnosed with that. But we are seeing it less, and we don't know how what's going to come with future strains. So we have to stay, vigilant, and we have to keep monitoring and studying this as we go, and making sure that we protect ourselves and our kids from that and future strains.
All right, and while you're on the subject, another parent asked, is Moderna's booster going to include the Omicron variant? What can you tell us about that?
Yeah, good question. Well, first off, and this is what I tell all my patients, I get my information from CNN just like all of you guys. So a lot of parents hear things even before I do, and they come in the office and say, did you hear this on CNN? It happened 5 minutes ago. Moderna did announce a new bivalent vaccine that we hear might be coming out in August. We hope that will cover the previous strain that was in the vaccine, plus some level of what's the now dominant Omicron strain. They say, in quotes, it will have superior neutralizing antibody response. That's Moderna's quote. So yes, there is one coming out, but remember too that the strains have continued to change. We saw Omicron back in March of last year, and since then we've gone through BA2, BA 2.1, 2.1, BA4, now BA5, and that does continue to adapt, and we'll have to continue to adapt the vaccine to make sure that we're keeping up.
Thank you. Dr. Kaufman, one parent asked live tonight on the chat, is there value in waiting to vaccinate until closer to the school year, like the fall, to maximize protection given the higher probability of infection during school?
So I would sort of go with the opposite, and I think the value would be to vaccinate sooner than later. I think the benefit of a vaccine and its efficacy in terms of conferring the immunity heading into school would be more important than waiting longer, especially if you're going to do the Pfizer 3-dose vaccine. Again, as a parent, I think it would be important to have my school-age child as fully vaccinated as possible heading into school. Questions about optional masking and all that kind of stuff, or no masking at all in close contact and exposure. We know that even if you are masked, the most effective way to prevent illness, and then of course serious illness and death, is to be vaccinated. So I would encourage them to get vaccinated over the summer so that they are fully vaccinated by the time school starts.
Thank you.
Can I just add to that, Dr.
Sure.
Rucoba? So I think that the one other thing, Dr. Kaufman, is I just want to add is that we're in a peak of COVID right now. I think parts of Chicago have gone into high risk, and the best thing we can do going back into school is drive those numbers down. And so getting vaccinated will help limit spread, like we talked about, and therefore limit the infections of COVID. And that's the best thing for us going back into school, is to have low numbers.
Thank you, Dr. Moosabhoy. Dr. Hochberg, this next one is for you. Why do you believe the vaccine is safe for kids under 5? I know we've touched on that a little bit, but can you speak to that?
So the known risks of COVID, which we've been discussing, far outweigh the potential risks of having a rare adverse reaction to this vaccine. Independent safety committees have reviewed this data, so it's not, no concerns about it just being the FDA or the CDC. They all have independent committees that have been reviewing this safety data, thousands of pages of it, and then have given their recommendations to those government agencies. Both companies continuously monitor the safety data and are watching for any long-term issues. Everyone, when they come into the offices, is given a Be Safe sign up, and so our patients are all signing up, and if there are any issues, those are all being reported, and then everyone is letting us know. It is also mandatory for Moderna and Pfizer, as well as for us, for the vaccination providers, to report any serious adverse events. There is no way, as we said, to know in advance how a child will do with COVID. So it can be a very serious disorder, and we want to try to keep them as safe as possible.
Thank you.
COVID-19 vaccines have undergone and will continue to undergo continuous safety monitoring. Billions of doses of this mRNA vaccine have been given around the world. And so there's a lot of data there, and it's all being shared with us. And so far, we've told you everything we know as far as the safety. There are no additional risks associated with this mRNA vaccine. Older vaccines, like the measles shot, induced an immune response similar to a natural infection. The mRNA vaccine gives the body instructions to produce the spike protein on the COVID virus to induce an immune response. The mRNA is broken down very quickly in our bodies, about 72 hours later, after it gets into the cells to deliver this instruction. It does not get into the nucleus, and it does not get into any genes. There is a very, very low risk of myocarditis and pericarditis. Myocarditis is an inflammation of the heart muscle. Pericarditis is an inflammation of tissue surrounding the heart. That being said, myocarditis or pericarditis from the COVID virus itself can be very severe and permanently damage the heart muscle. This happens about 450 times per million young males. It seems to affect young males more than women. And people are 6 times more likely to develop myocarditis as those who have received the vaccine. Myocarditis from the vaccine seems to occur within 7 days or so after the second dose, and is much more common in older adolescent males. It can cause chest pain, heart racing, trouble breathing, but it is much, much less there are much less symptoms than in myocarditis caused by the COVID virus. There is no increased risk in any children that have any congenital heart disease or any previous heart issues. And it is usually very mild and resolves without any treatment or with minimal conservative management in a pretty short period of time. In no patients has it impacted quality of life or caused any extended any extended disorders. And this occurs about 4 to 7 times per 100,000 doses, again, in older adolescent males. With the Moderna vaccine, it's mostly in males 18 to 24, and the Pfizer vaccine in ages 12 to 17. It is incredibly rare in children under 12. So from all of this research that's been done and from all the safety data that has been compiled, these vaccines are considered very safe.
Thank you. One mom writes in, I'm up to date with vaccines and I've been nursing. Does my 1-year-old need to get vaccinated immediately? What level of protection did nursing provide him? And similarly, another mom writes in, if a child has antibodies from breast milk, why would the vaccine be necessary? And what do you tell those moms, Dr. Moosabhoy?
I think that's really true. One of the biggest reasons that, or one of the big reasons that we recommend nursing in breast milk is that moms pass their immunity to the baby, and you protect your child from exposures to illness, whatever illnesses are around, and whatever antibodies mom has circulating. And so a mom that's circulating antibodies to COVID, there was a study in November of 2021 that showed that the antibodies do pass through breast milk to the baby. And so you are providing those benefits. I think it's important in order to understand why we still need to vaccinate these children. I like to think about our immune system as like an army or a military at war. And the antibodies are kind of like your soldiers. So your soldiers, if you put them out in the field to fight a battle, they may do very well and they might win the battle. But without support, it's very difficult for them to sustain. The vaccine provides you with that support, right? Your vaccine helps you develop the B cell and T cells that actually produce these antibodies. So they're like your fortress or your camp. And they're developing more soldiers to continue to fight and sustain against the multiple exposures that you may have to COVID. And so it's really important for the body to be able to protect itself and to produce these antibodies for any exposure. So I think that you're looking at the protection from the mother, but also getting that vaccine as well.
Thank you. Related to your last question, Dr. Kaufman, here's one we get from a lot of parents. This is a little bit different take on it. My child will be 5 in November. Is it better to wait until then so he can get the higher dose vaccine? And what do you say to that parent?
That's a great question. I think the short answer would be do not wait. And the reason I say that is, it's interesting because everything that we sort of promoted in pediatrics in the past in terms of medications has been weight dependent. And the COVID vaccination is an age dependent vaccine. And actually what they showed, and one of the reasons why it took so long to approve the under 5s was the dosages. And what they showed was that the high level of neutralizing antibodies for the 2 to 5-year-olds with the lower dose were comparable to the children that got the higher dose at age 6 to 11. So you can actually get a better response with a lower dose if you're under 5. So for reasons that were discussed earlier, if your intent is to get your child vaccinated by the time school starts, then I would recommend not waiting because the response to the vaccine would be just as good as if you waited.
Thank you. Dr. Hochberg, here's a question from a very knowledgeable patient who obviously has been keeping track of these things. Why was the vaccine not approved the first time? And what has changed that should make us more comfortable? What do you say?
So this is referring to the Pfizer vaccine. We were all really looking forward to delivery this past winter in February of the Pfizer vaccine. And when Pfizer first completed the studies this winter, the lower dose of the baby vaccine, which is the 3 micrograms, did not show the efficacy that they were hoping for. So it was very safe and the side effects were minimal, but it was, around a little less than 50% in reducing severe infection. So they decided to add a 3rd dose, again, about 8 weeks after the second dose, And the efficacy of reducing severe infection increased to 80%, which is great. So Moderna, like we said, is currently studying a third dose, but Pfizer decided to hold off on submitting to the FDA until they had completed the studies on that third dose.
Thank you. I know it's hard to predict the future with this virus. It constantly changes on us. But this question comes from a parent. Do you anticipate boosters to be administered for any age groups regularly in the future, similar to what we do for flu season? And there's a couple questions that came in on the live chat tonight about boosters. How long after vaccination is completed do the kids need to get a booster? Once a year, like a flu shot? What are you recommending? Dr. Moosabhoy, what do you say?
Great question. I think we're all kind of thinking the same thing. And first of all, I think when we're thinking about the kids getting their first doses, we'll take it one step at a time, get them vaccinated now, get them covered so that they're protected. And we'll be learning more and more about boosters for the young kids as they're studying and watching the immune response over time, and when their antibodies trail off. They found that, or they've seen in the studies of the adults that that antibody response starts to drop by about 4 months, and between 4 to 6 months, you really see a drop in your antibody response. So that's why they approved that booster at the 5-month mark for adults, that third dose or the booster. And then, of course, that's now been approved for kids 5 and up. And at the moment, this is the vaccine we've got. It seems to lose or decrease in effectiveness around that 5 to 6 month mark. And so we do have to keep boosting every 6 months. We hope that they'll be able to make improvements to that vaccine to hold immunity so we can last a year and have to get the vaccine less. But we have to work with the vaccine that we have now. And this is kind of where we're at. As far as comparing it to the flu vaccine, so we're already kind of seeing that, right? The Moderna is coming out with this bivalent vaccine that's covering the mutation that was Omicron. And if we do continue to see more mutations that are significant enough to be able to, avoid the vaccine effectiveness or decrease the vaccine effectiveness, then they will have to continue to adjust and add new strains to cover, to help us cover and protect us.
Thank you. All right, Dr. Kaufman, here's a common question that we've been getting. Several questions related to this came in with the written questions, and several questions came in tonight live, all asking the same thing. And basically it's 2 questions. One is, if your child's already had COVID, would you advise them to get the vaccine? And 2, if so, is there a time interval after getting COVID that you would recommend that they wait before getting the vaccine?
Yeah, so yes, we would definitely recommend COVID vaccination after illness. I think as the previously been discussed, I think the data that I see really relates to kind of like what Dr. Moosabhoy said about the Army and then the reinforcements and the brain trust. There's data that I saw that says that basically 32% of children fail to make antibodies against COVID after confirmed infection, and then their T cell, which is their brain trust, only had mediocre response. And then with the vaccine and having illness, that response is much greater. So this concept called hybrid immunity of getting the illness and the vaccine together is your best defense and most complete army against the virus.
Thank you. Here's another question we've gotten asked frequently and came in again on a live question tonight. This is for Dr. Hochberg. Any signs of fertility issues for girls getting the vaccine?
So no, there's been no effect on fertility at all with the vaccination. In fact, there have been thousands, if not more than that, women who have easily become pregnant after they've had their vaccine. COVID itself, the virus, can temporarily decrease fertility in males. but the vaccine has not been shown to cause any decrease in fertility. Some young women have felt that their periods were a little delayed or a little irregular for a few months after the vaccine, though not to the extent of causing any major problems, and then return to normal. This may have been a reaction to a result of an inflammatory response, but again, everything became normal after that. So there, again, have been no effects on fertility. And as I said in my last comment, there's been, the vaccine does not get into our nucleus, it doesn't get into our gene pool, and doesn't affect any upcoming pregnancies.
Thank you. Here's a question for Dr. Moosabhoy. It's been on a lot of parents' minds. How long will the vaccine protection last?
Yeah, good question, Ruben, Dr. Rucoba, thank you. I think we touched on this a little bit previously, but they've studied the adults, right, and vaccine effectiveness and antibody production in adult bodies, and they've shown that there's a steep decline that starts around 4 months and goes through 6 months, and so they've shown that we all need to get boosters about every 6 months. Right now, the first booster is available for everyone 5 and up. The 4th dose is available for those 50 and up, and we expect that at some point that's going to be available for everybody. The verdict is still out on the 5 and under. I think they will continue to watch that antibody response and let us know what they're seeing with the data, and the data tells all. So when they're starting to see a trend in antibodies decreasing, that's going to show us that the vaccine is no longer effective and we need to get a booster. So that exact verdict is still out, but if we look at the trends from before, we can expect that it'll probably be around 5 or 6 months after that 3rd dose.
Thank you. All right, here's an interesting question for Dr. Kaufman. One parent wants to know, after getting vaccinated, would you still suggest indoor masking?
So that is a good question. And if you don't mind, Dr. Rucoba, if I could maybe do a quick follow-up. I forgot to mention a couple of things before on some previous questions, if that's okay.
Sure.
But we mentioned that the vaccine is an age-based thing and not a weight-based. So I think one of the questions come up is vaccinating babies that are born prematurely. And as far as I know, there's no data suggests that they should not be vaccinated by their age, actual age, chronologic age, and not the corrected age. And so it is currently recommended that 6 month, when a premature baby hits the 6th month, they're eligible for that COVID vaccine series. And then the second thing I neglected to answer about the time after you've had COVID illness to get vaccinated. And when everything first came out, we were told to wait 90 days so that you basically, would be the vaccine would be more effective. And the current understanding is that you just wait till you're past the contagion period. So, whatever the 10 days, 2 weeks, whatever it is, you can go ahead and get vaccinated. So I apologize for not answering those before. But the masking question is really interesting. I think it relates to a lot of things that are sort of more personal. One relates to obviously the age of the individual and what the effectiveness of masking is. We know that masking can help prevent transmission and contracture of illness, but we also know that the vaccination is much more effective, and especially in preventing contraction and then serious illness and hospitalization. Things that would be personally considered, again, would be the age and their willingness to mask, the degree of social contact exposure, what's the positivity rate or the incidence in the area, and how does their risk of exposure increase based on the positivity rate. And then the last thing to consider is what is the risk factors within the household? Is there an immune compromised adult or a grandparent or a relative in the household that they would want to visit? So the best case scenario would be to vaccinate and mask, but also masking still has a lot of other factors that go into it that need to be considered.
Thank you. Dr. Hochberg, this question has come up both in the written questions that came in and again tonight on the live chat. I want to break this down into 2 questions. The first one is, has there been any study about benefits or risks of administering this vaccine during the same visit when other vaccines are given? And somebody wanted to know tonight, specifically, if there has to be a time period of waiting after you've gotten the COVID vaccine to your other vaccines, or vice versa, your other vaccines waiting until, a certain time period before you can get the COVID vaccine. What do you say?
So COVID vaccines can now be given simultaneously with other vaccines. So if you're in for your 15-month appointment, you can get your other vaccines as well as get the COVID vaccine. When the vaccines first came out, when we were giving them just to adults, the CDC previously recommended waiting 14 days after being given another vaccine because they didn't have this data. Now we've had the luxury of vaccinating, millions and millions of people, and collected safety data, as we said. And they found that the co-administration of the COVID vaccine with other vaccines was completely safe and had the same mild side effects. They also showed that it allowed the COVID vaccine to work just as well to elicit the same immune response when it's being given by itself or being given with other vaccines. So a completely safe and effective way to vaccinate. They just needed to do those studies after those original vaccines came out. So yes, it is perfectly fine to get the COVID vaccine at your well visit or to come in at a different time to get it, but it is safe to give with other vaccines.
Thank you. As a follow-up to that question, here's one for Dr. Moosabhoy. Will this be added then to the routine vaccinations in regular checkups?
That's a great question. As Dr. Hochberg said, we're already giving the vaccines at well visits. We started that as soon as the vaccines came out for the younger ones. We've been doing that for the older kids when they'd come in for their checkups or for vaccine visits. To answer that question, it's very safe to give, as Dr. Hochberg mentioned, it's very safe to give it with other vaccines. I think that it'll be hard to identify a specific age or date that or visit that the kids will, that we can make it, routine or specific to that visit, because kids are getting this vaccine at different times and at different ages. But I think at every visit, we'll be addressing what your vaccine status is, whether you're due for a booster or whether there's a booster available for your child, talking to you about the effectiveness of that vaccine, the safety of that vaccine, and helping you make sure that your child is vaccinated and protected and safe. And so that's a conversation that I know all pediatricians and PediaTrust are having with their patients and kind of talking through and helping to alleviate any questions that they have. And then having that vaccine available at that well visit so that it's easier for you to get it done and not have to come back and make another visit and another trip into the office to get it done.
Thank you. One parent wrote in, my child just turned 5. Which vaccine should they get? That's a good question. Dr. Kaufman, how do you answer that?
Yeah, and the answer is that you can't go wrong with either one again. So your choices are the old Pfizer vaccine, which is approved from 5 through 11, or the new Moderna, which is age 6 months through 5. Again, can't go wrong, 3 doses versus 2 doses. But again, the Moderna is likely to be a booster down the road. So to me, it would be about availability, access, and then, getting it done before school, but you cannot go wrong with either choice.
On a related note, Dr. Hochberg, one parent wants to know what vaccine should our child get if the child turns 5 in between 2 of the doses?
So we've been working on that one, and both Pfizer and Moderna have come out with cheat sheets for us, which I'm holding right here, but I will explain. So basically, you can't. They're giving us a lot of leeway in answering this question. So let's say a child. Let's talk about Pfizer first. Child comes in who's 4. 4 and 11/12, or, about to turn 5, we can give the 3 microgram dose. I'm going to call that the baby dose. And that's what I think most people will do. But it is also acceptable to give the 5 to 11 dose. So let's say a child's going to be 5 in a week or 2 weeks or whatever, you may just want to choose to use the 5 to 11 dose. And that is considered acceptable and safe by Pfizer. Okay, so let's say a child turns 4 between doses 1 and 2, turns 5 between doses 1 and 2. When they're turned 5, then they get the 10 microgram dose, or the school age dose, we'll call it, for their second dose. And then their third dose, they also get the school age dose. Again, if a child is 4 for the first 2 doses of Pfizer, and then they turn 5 after that, which is possible because that's 8 weeks later, they would then get the school age dose at the third dose. So that is the kind of complicated answer from Pfizer, but basically it's all okay, and none of it is considered unsafe or that it wouldn't count per se. For Moderna, it's a little easier at this point because they only have 2 doses. So if you're 5 at your first dose, you get the 6 month to 5 year dose, the 25 microgram Moderna dose, and then at age 6, if you're 6 at the second dose, you get the 50 microgram dose of Moderna, which is for children 6 to 11. So that's a little bit easier, though it is acceptable, Moderna says, to give either one. If you're on the cusp, you only have one versus the other, you can give either one, the 25 or the 50 microgram dosing. But the most likely recommendation is if you start at age 5 and you turn 6, give the 25 microgram first and then the 50 microgram after that.
Thank you, Dr. Hochberg.
And don't worry, we have these posted in all our offices, so we will figure it out. You don't need to worry.
All right, this next one is for Dr. Moosabhoy. How does this vaccine, the one for kids less than 5 years old, differ from the one administered to adults?
Yeah, so there are basically, I think, two things that come up in the differences in the vaccines. The most important is the dosing. We know that I think we've kind of gone through these numbers a couple of times, but just to kind of rehash, the Pfizer vaccine is reduced to 10% of the adult dose. So the adult dose is 30 micrograms and the under 5 dose is 3 micrograms. Remember that the 5 to 11-year-old dose is 10 micrograms, so it's different from the other 2. And the older than 5 is 2 doses, the younger than 5 is 3 doses. And then for Moderna, same concept, right? A little bit of some dose differences. Moderna's vaccine is reduced by 25% of the adult dose. The adult is 100 micrograms, and the under 5 is 25 micrograms. Both of those remain a 2 vaccine series. And remember that 6 to 11 is a 50 microgram dose. So that's a little bit different. So just mainly the dosing and the schedule for administration that are different. Otherwise, the components, everything is the same in both vaccines.
Thank you. Dr. Kaufman, one parent asked, how long do we wait before the vaccine shots? I'm not sure if they meant how long in between the shots or how long until we have them available at PediaTrust offices. And I can certainly answer the latter part of that question. Can you address the former?
Sure. So I think the dosing intervals for the different vaccines has already been discussed, and I'm sure it's posted somewhere. I think the things to kind of remember about the dosing, the vaccine interval recommendations are that they're guidelines. And when we refer to 21 days or 8 weeks or whatever, those are what we would consider minimum intervals. And we realize that things happen in people. So if somebody were to get sick, or maybe in between a dose, somebody did end up contracting COVID, obviously they would need to finish their quarantine, isolation, contagion, or their acute illness. But as far as the distance between vaccines, again, I think they've already been discussed. Again, better late than never, I guess, is the point I'm trying to make.
Right. Okay, thank you. Dr. Hochberg, somebody wrote in tonight on the live chat a question. If our son gets vaccinated and then contracts COVID within the month before the second shot, is there any increased risk of severe COVID or increased side effects due to the vaccine administration and the subsequent COVID infection?
No, there's no increased risk. Obviously, we would have your child recover first from that COVID infection. And so even if that means extending the interval a bit before given the second or the third vaccine, we would just wait until they were completely recovered and then vaccinate them. But there is no risk of increased side effects. And hopefully, because they're getting vaccinated, their symptoms from COVID will be decreased even just with 1 or 2 vaccines.
Thank you. All right. This next one is for Dr. Moosabhoy. My son has a port wine stain. Is there any concern with getting the vaccine for kids with abnormal vascular malformations?
Good question. I mean, I think, and I think this addresses something even bigger, because everybody has, different. All children are different, and our children might have different chronic diseases or other things going on that we may wonder how the vaccine is going to affect your child. But I think the studies have been very clear on this. There are really very few contraindications to getting the vaccine. And the main one is if you've had an anaphylactic reaction to a vaccine or to COVID vaccine or any component of the COVID vaccine. That's really the one and only main contraindication to getting the COVID vaccine is that. Really in all other studies and in evaluating other people from adulthood now down to the young babies, they found that the vaccine is very effective and very safe with all other chronic people with chronic diseases and other issues. So I think that's been very clear, and I think it's very well studied.
Thank you. Dr. Kaufman, this question's for you. Somebody wrote in on the live chat tonight. They wanted a little clarification. Can you please explain what the efficacy percentages mean? What exactly does that 40 to 50% for Moderna mean, or the higher rate for Pfizer?
Yeah, so it gets a little bit technical, and I think what the FDA and what the clinical trials do is they determine an antibody response from the vaccine, and they determine what would be considered a minimal acceptable effectiveness. So what antibody level or threshold would be proven to be effective, and then that's what then they get this number, and then they determine the percentage of the individuals who got that vaccine that have that minimal antibody response, and then based on the next dose and then the subsequent dose, and they get the percentage of efficacy. So that's what that really refers to. And I think historically in pediatrics, if you think about most of our infant and toddler vaccines, they're done in series as well. And so this is not a new concept in vaccinations in infants and toddlers. Pertussis vaccine is certainly one example where you get further along in terms of effectiveness, antibody response, and immunity after some series of doses and boosters and things like that. So did that answer your question? I think hopefully
so.
Okay.
So I want to address a couple of questions that came up tonight. One was very simple. A PediaTrust patient wanted the Moderna vaccine. They don't get it at their PediaTrust office. Can they just call Woodfield or Elm Street? And the answer to that is yes. The phone numbers for those offices are on our webpage, PediaTrust.com. And you can certainly just give them a call and tell them that you're a patient at another office and they can handle it. For those of you who are trying to make an appointment for a vaccine at your own office, don't call them because the phone lines will then be flooded. You can certainly go on My Chart and request an appointment for a vaccine that way. And there was another point brought up that somebody wanted to know why Walgreens does not vaccinate kids less than 3 years old. And all I can tell you is they don't. I don't make the rules for Walgreens. So that's why those youngest kids really need to get vaccinated at a pediatrician's office.
Dr.
and-
Rucoba, my understanding is the pharmaceutical licensure does not extend to children under the age of 3. So it's a licensure issue. It's not a philosophical issue.
Okay. So, and somebody asked, can I get the first shot at Walgreens and then finish up the shots at the office? However you can get the shot, get the shot. They won't give it to you, obviously, or your child less than 3. But if you got a 5-year-old or a 4-year-old, you can certainly do that. We just want to get the shots in the kids as quickly as possible. So I think the big take-home message tonight is either vaccine is effective. They're both safe. We encourage you to get your children vaccinated quickly. Don't wait. You know, it's the safest way to protect your children against COVID, even if they've already had it. The studies do show that because these vaccines came out during the Omicron surge, that they really did protect the kids from Omicron and from some of its variants that are circulating now. So it is effective. Both of them are effective. Both of them are very safe. And we certainly encourage it for all kids who are 6 months old and up. All right, it's getting it's a little past 7 already. So I know we didn't get to all of the questions that were posted on the live chat tonight, and I apologize, but we did want to wrap this up at 7. So thank you all. If you have further questions, obviously bring them up with your PediaTrust provider, and hopefully your kids are going to get vaccinated very soon. Thanks, everyone. Have a good night.